Alrighty. Hi,
Um,
everyone.
Hello?
Hello? Hi. Sorry about
Oh,
that. Can you hear me okay?
yeah, I can hear you now.
Awesome. Okay. Excellent. Thank you so much for taking the time to meet with me today. I know it's been a lot these past couple of weeks, but how are you and Miss P doing?
Um, we're hanging in there. She's still really tired and she still doesn't have too much of an appetite.
That's completely understandable after her injury. Fatigue can make things like eating a lot more difficult. And today we're going to talk about some ways to help make that a safer and easier process for her. So I'd love to go over Ms. Pete's swallow evaluation results and explain the therapy plan we have in place, so that way you know exactly how to help her going forward. And before we dive in, can I ask, how have mealtimes been going for her?
They've been doing all right, but like I said, she's kind of struggling with without the like drinking water without really choking or anything like that, and same with other liquids.
You know, that's actually really helpful to know, and it actually matches with what we saw in her swallow study. So those thinner liquids like water, they tend to move just too fast for her right now. So we'll be going over some strategies and exercises to help make those safer in the future. But right now, my goal is to help you understand what's going on and how you can help best support her while she recovers. Okay?
Of course.
Right. So let's get started with what normally goes on during a swallow. And allow me to share my screen here, and that'll help me finish the diagram. Give me just a moment. Can you see my screen okay?
Oh, yep, yes, I can see it.
Excellent. Okay. Oh, uh-oh.
Oh,
Sorry about that. Give me just a moment. Let me reshare my screen. Sorry about that. Give me one moment. Okay, how's that?
1 second. Yes, there it is.
Oh, excellent. Okay. Sorry about that. Perfect. Okay, so back to this. Um, we're talking about swallowing, right? So swallowing happens in three quick steps. We're gonna have our oral phase here. So this first step, where this blue is our food or liquid that's in our mouth, right?
Right.
Our tongue is gonna push that food or liquid to the back of the mouth. That is what happens during our oral phase. In our second phase here, the pharyngeal phase, that food and liquid is going to be pushed down our throat with the muscle in our throat contracting to push it down at the same time as our airway closes off here. So this is our throat where we go to eat, and then this is our airway here. In our third and final phase of the swallow, that food and liquid is going to enter the stomach. So normally, all of this happens in about 2 seconds or less, and it's a very quick and automatic deal, right? And the most important part for safety is going to be during this pharyngeal phase here, when the airway is going to be closed off, and it'll prevent any of that food or liquid from entering our lungs. We don't want anything other than air entering our lungs. Does that make sense so far?
Yeah, it does. So what exactly closes that airway?
That's a good question. So I don't know if you can see my cursor here. Can you see that?
Yeah, I can see it.
Excellent. So this little flap here that's hanging down, if you look in this first image, it's up, and then by the second image, it's going down, right? This is a pile of tissue here in our throat that we call our epiglottis, right? So when we go to swallow and we're using our throat muscles are contracting to push that food and liquid down, this epiglottis is turning downwards to close off this entrance here that to our lungs and our airway, right? To help protect it. So that way no food or liquid is going to spill in to our lungs. Again, we don't want anything other than air entering our lungs. And so, unfortunately, with Miss T right now, those thinner liquids like water, or even like coffee or tea, broth, those kind of consistencies, they're trickling in and they're going into her lungs, causing her to cough and just all around discomfort, right? So that's what we want to avoid here. Does that make a little bit more sense as to what's going on here?
Yeah, that definitely helps.
Definitely. So timing and closure. Those are exactly what we're going to be working on in therapy with Miss T. Let's see. So like I said, those thinner liquids, she's struggling to not cough on them or have them trickle into her airway right now. And that's mainly because her throat muscles aren't as strong or as quick right now because of that brain injury. And what we can, however, when we offered her things like a puree or a mildly thick liquid, she did a lot better with swallowing those. As these consistencies can move a lot more slowly and they allow her body extra time to protect her airway here. So right now she's safest with the foods like applesauce, mashed potatoes, yogurt, and some other drinks that have a little bit more thickness to them, like maybe a smoothie or even a creamy soup. Excellent. Any questions so far, or how are we faring?
No, that makes perfect sense.
Wonderful. Okay. So moving forward, I'll be going over some specific swallowing strategies that will, in just a minute here, that will help Miss T in her recovery process. Okay. Here, let me stop sharing here so I can talk to you. Excellent. Okay. Let's see here. Okay, so yes, those swallowing exercises. These are going to be designed to help her rebuild strength and her coordination, so that way her swallow reflexes are working the way that they should again, right? Because right now, as I said, her muscles need to be a little stronger, her timing needs to be just a little quicker, and she's really going to need these strategies to help keep her airway protected while she's eating and drinking in her recovery process. So in therapy, we'll be focusing on three main things. We'll be focusing on building strength in her tongue and throat muscles, so that way they can squeeze harder and move the food and liquid down more effectively. We want to improve her timing, so her airway closes at just the right moment, keep that food and drink out of her lungs. And finally, we want to help her practice using safe swallowing strategies during meals, so that way she can eat and drink with less risk while she's still recovering. So the ultimate goal here is for her to move towards that regular diet again without any coughing episodes or any risk of things entering her lungs. And just how does that plan sound to you?
Yeah, that sounds like a good plan. Sounds like it'll really help her, return to that normal function.
Perfect. And you know what? Returning to normal function, that's exactly our goal too. With your support as well, she'll have the best chance of making steady progress. Okay, so let's go over two of specific restorative exercises that we'll be using in therapy today, okay? So these exercises are designed to strengthen and to retrain her swallowing muscles over time. So we're not just trying to find temporary workarounds, we're really working towards lasting improvement, right? You can kind of think of them like physical therapy, but for her throat muscles. And I'll be sure to explain each one, show you how they're done, and then we'll actually have you try them so you feel confident helping her practice. This first one that we'll talk about is called an effortless swallow. Excuse me. And during an effortless swallow, it's performed just like it sounds, with effort, right? She's going to swallow really hard like she's eating a spoonful of peanut butter. And the goal here is to really get all those swallowing muscles to work harder. We want her tongue to push more forcefully, her throat to squeeze more tightly, as this is going to help the food and drink clear from her throat and reduce any chances of anything getting left behind, right?
Yeah, so it's basically just building that strength back.
Definitely, yes. This one is going to focus exactly on her muscle strength and like power behind that swallow. So when she's doing it right, you're going to notice a bigger movement in her throat, and you might even hear her have a louder, like gulping sound. And some helpful ways that you can help cue her will be to remind her to swallow hard or to give her your strongest swallow. This next one that we'll talk about here is called the Mendelssohn maneuver. And this one's more about timing and airway protection rather than strength. So she'll start with this one when she swallows. So start to swallow, excuse me. And when her voice box lifts up, she'll hold it there for about 2 to 3 seconds before finishing the swallow. That extra hold keeps her airway closed for longer, giving food and liquid more time to pass safely through her esophagus. Does that make sense so far?
Yeah, so if she forgets to hold it up?
You know, that's actually really common at first. And you can just help remind her before she starts by saying something like, oh, hold it and finish. And if you actually place your fingers gently on the front of her throat, you can feel when the voice box lifts and when it drops. So that'll help you check if she's holding it for long enough as well. Alrighty, well, let's have you try each one as well, so that way you know exactly what they're like and what to look for when you're helping her.
Okay.
Sound all right? Perfect.
Yeah.
Okay, so let's start with the effortless swallow. I'll demonstrate first for you, and then you can have a go at it and get a feel for what it's like and what she should be doing, okay? So I have some water here with me. I don't know, do you have a drink with you at all?
Yes, I also have some water.
Excellent, okay. So I'm gonna take a sip of my water, and I want you to pay close attention to how much strength and force I'm using when I swallow, okay?
Okay.
Here we are.
Oh,
Did you
okay.
know that was more forceful?
Yeah, for sure.
Definitely. So that's exactly what we're looking for. Why don't you go ahead and give this one a try? And just imagine that you're eating something, you're swallowing something really sticky, like peanut butter, right? You really got to push it down. Great. I can see the extra effort that you put in your throat. That was excellent. Now, let's try this one more time and just try to focus on making it as strong as you can, okay? Try one more time for me. Excellent. Now, that's the level of effort that we really want to see from her each time, okay? That'll really help build back that strength that she's lost. So now let's move on to that Mendelssohn maneuver, okay? This is our second strategy. First, I'd like you to gently feel the front of your throat for me, okay? Where your Adam's apple is. So when we swallow, our Adam's apple will raise, which is part of what helps close off our airway, right? So go ahead and try swallowing and just see if you can feel it raise.
Yeah, I feel it kind of go up and inwards.
Yeah, exactly. So when we perform this exercise, we want to gently hold that position when our Adam's apple is raised for about 2 to 3 seconds before we finish swallowing. So allow me to demonstrate. Could you tell how though I held it and paused in the middle of my swallow a little longer than normal?
Yeah.
Yeah, that was okay to see? Perfect. So that's really the key to helping keep our airway closed for longer, right?
Okay.
So now I'd like you to give it a try. And so when you're going to swallow, I want you to hold that position for about 2 seconds before finishing, okay? And I'll watch and see if I can see that lift, okay?
Okay.
Oh, perfect. I saw that lift. Let's try doing that one more time, and this time I'm going to count out loud, okay?
All
So
right.
whenever you're ready. 1, 2, and finish. That was excellent. I know it's a little awkward at first, but
It is.
it's a little uncomfortable, right? But this is going to be excellent for when you're helping her at home, right? So you can use that same strategy I just used with you, but with slow counting, to help her hold it for longer, right? Because it is kind of uncomfortable and awkward to get used to when you're not used to doing that, right?
Yeah, it's a little unnatural. Like you said, it's normally only like 2 seconds total. Now it's like 2 seconds in the middle.
Yeah, exactly. So this is going to help her see a lot because she's really needing that extra time to keep that airway closed while that food and liquid passes through into her stomach. But if you start to notice that she's getting tired or maybe even frustrated with how it's going, I just want you to know that it's okay to take breaks. We want to make sure that we really value the quality of her swallow versus the quantity. So if we're trying again and again and again and she's just getting more frustrated or fatigued, then it's totally okay to take a break and come revisit it, right?
Right. Makes sense.
So, like we just talked about, this is a little bit more challenging because she's having to hold it in the middle of the swallow. And that's exactly why your cues are going to be so important from the start. Over time, we're going to want her, or over time, she'll start to get used to it and she'll be able to do it more automatically. Perfect. Do we have any questions so far? I know that was a lot of information we just covered.
No, that all made sense to me.
Perfect. So let's talk about where we'd like her to be between our therapy sessions, right? The goal is to keep those swallowing muscles active and retraining even on the days when I'm not there for therapy, right?
Right.
I'll also make sure I send you a printed handout so that way you have something to reference as well, okay?
Okay, thank you.
Cool. Okay, so let's see. Here's what we'll start with for now, I think, when we're at home or when you're with her to practice, okay? We'd like, excuse me, so I'd like her to do 10 of those effortful swallows and then 10 of those Mendelsohn maneuvers twice per day, okay? So you can help cue her by keeping count. And we also want those pair of exercises. We want to pair those exercises with safe swallowing strategies during meals, right? So these are just as important as exercises themselves because this will help her keep safe while she's still healing, right?
Right.
So it's really important that when she's eating during the meal, that she's sitting fully upright, ideally in a chair when she's propped up at 90-degree angle, right? If she reclines at all, that's going to make it a lot more difficult for her to keep that airway closed. We really want to encourage her to take small bites and sips. So small bite of food or small sips, because even if she does have, it does go down the wrong pipe, a little bit is a lot more safe than a lot, right? It's also important that we can encourage a double swallow. So that's just, I'm sure we've all done it before, whether we realized it. We had to swallow something and then, didn't all go down, so let me swallow again, right?
Yeah.
It can be a little uncomfortable, but if we're forgetting to do that, then that's when we have residue in our throat, and we really want to avoid that. So encouraging her to, after each bite or sip that she takes, to swallow again, make sure it's all done.
Okay.
And like I said, we're trying to avoid any thin liquids for right now. We really want to stick with those pureed foods like the mashed potatoes, mild basic drinks like smoothies, yogurt, just to avoid what we talked about earlier, right?
Right.
Okay, and lastly, we really want her to stay upright for at least 30 minutes after eating or drinking, right? To help make sure that no reflux is happening, that nothing just getting stuck there, just to make sure that she's all doing great. Does that seem doable so far?
Yeah. 30 minutes.
Okay, excellent. So I'll make sure I give you a printed copy of that so that way you can post it up with you, and so that way anyone helping her, it's not just you, they can make sure that they follow these same steps, okay?
Okay, that would be very helpful.
Absolutely. All right, Ryan, that covers everything that I really wanted to go over with you today. We talked about the results of this two-swallow study, her plan for therapy so far, 2 key exercises, and some of that homework that I'm sending home with you. You're doing a great job of really picking up on this quickly, and I can tell that she's really going to benefit from having you involved.
Thank you.
Okay. If you notice any changes, like she's starting to cough more, any signs that maybe she's working harder to swallow, or if you notice that she seems tired before she finishes a meal, if you can, it would be wonderful if you could just jot that down so that way we can talk about it in our next session, right?
Okay. Yeah, I'll definitely do that.
Definitely. We'll keep working together each week to help build her strength and timing so that way she can get back to enjoying more of the foods and drinks that she loves.
Yeah.
How are you feeling so far about everything we covered today? Do you have any more questions before we wrap up?
No, I think I just about got it. I think the handout will really help me, remember everything, and I'll make sure to watch and make sure she's doing everything correctly.
Perfect. Well, thank you so much again for being such a key part of her recovery, and I'll be sure to see you both at our next session.
Yeah. Thank you too.
All right. You have a great one.
Bye.